right. Welcome, welcome. Thanks for taking time out of your Tuesday morning to be with us today. This is Ellen Wynn. For those of you that don't know me, I'm an independent agent with David Allen Capital, and I started with DAC back in June of 2018. So I'm super excited and very fortunate to be your trainer today. I'm doing these calls on Tuesdays, 11:30 Eastern Time, talking about healthcare and RX plans. So let me go ahead and let you know if you have questions about either or you have a success story that you want to share after I go through some basic information that I want to cover today. If we have time, I'll open up for questions there at the end. I do want to keep this under 30 minutes, so we'll wrap up before noon today so that everybody can get back to work, okay? But let me get into a slideshow. I've pulled together some information about the healthcare industry in general, and specifically health insurance, because now our plans are not insurance. It's a health share plan. If you're looking at our DAC co-branded with Clearwater plans, they're health shares. But I want to talk about health insurance and how confusing it is for the average person, and why what we have is such a blessing to the average individual. So let me get into screen share. And I'll start out. Are you seeing my slide okay there?
Yes, we are.
All right, perfect. Okay, I want to start with some statistics, okay? And this came from an insurance brokerage company as I was surfing the internet. A recent survey of people that were tasked with shopping for and providing their own insurance, meaning that their employer wasn't providing insurance for them, showed that only 9% of the people shopping for their own insurance had a basic understanding of the four most basic health insurance terms. So I'm going to cover those today and kind of take you through how they apply to us or don't, because again, we're not an insurance plan. So insurance plans have premiums, and that is the amount that you pay the insurance company for the privilege of having an active insurance plan, right? Well, with our DAC Clearwater plans, we have membership plans, membership fees. And that's what we pay every month as a member of the plan. We pay that instead of a premium, because it's not insurance. We're paying our monthly membership fee, or what our actual out-of-pocket cost is to have that coverage, right? The second term that only 9% of people really understand is copayment. A copayment or copay is the amount you owe each time you receive certain types of medical care. In our case, if you have our basic health share plan or our advanced health share plan, or I'll just say those two because those are the two most common. We have copays for primary care, and we have a copay for specialist visits. In fact, our advanced plan has a copay for blood work, x-rays, MRIs, all of those expensive treatment, expensive diagnostics, right? But the copay is all you pay. With our plans, you also have your preventative care that is covered for free on that basic and the advanced plan. But the copay is all you pay. Can vary depending on the type of service that you're getting. On our basic and advanced plans, you pay a $20 copay for each visit to your general practitioner. And that's it, unless they're doing some diagnostics or blood work, and you may have that additional copay for those. But $20 copay for those visits, and then a $50 copay for the specialist. And it's not anything on top of that. That's all you pay on the copay. Coinsurance is the third term that most people don't understand. Coinsurance doesn't apply to our plans, and I'll explain why, but let's talk about what coinsurance is. After you've met your deductible, now this is talking about a traditional insurance plan where I'll go down to this last line where it says the average, that's the average out-of-pocket max. A lot of people have high deductible plans where they're paying $5,000, $7,000, $8,000 out of pocket on a deductible before their plan actually kicks in. So coinsurance is after you've met your deductible for the year. So let's see, if somebody has traditional insurance, they're paying their monthly premium, and then they have to meet their deductible before their plan really kicks in most cases. So their out-of-pocket expenses are tremendous on traditional insurance. So after you've met that deductible for the year, you're not off the hook when it comes to your medical bills. This co-insurance is where you pay a percentage of the medical expenses. For example, you might meet your $2,500 deductible in May, and from then on, your co-insurance, if you're on an 80/20 plan, would be $20 that you pay out of pocket for every $100 bill, right? If you're an 80/20, you pay 20, the insurance company would pay 80. Again, don't want to confuse you. This is traditional insurance, but just kind of giving you some insight into how traditional insurance can be so confusing to the average person. And then that out-of-pocket max is all you pay towards each plan throughout the year is the max you'll pay out of pocket. Jake covered on our Clearwater trainings that the average out-of-pocket max is over $9,000 on individual plans. The good news is with our plans, you're going to have a lower monthly membership plan cost. Okay, as we go down the basics, you're going to know what your copays are on all of the plans. It's just spelled out right there in the presentation when you get someone over to talk to our benefits consultant. We don't have co-insurance because your coverage is either covered at 100% on preventative care visits. You have a flat copay for the services, and those are spelled out, or you're working on your out-of-pocket max, which we have low out-of-pocket maxes of $1,000, $2,500, or $5,000 max out of pocket. And once that max out of pocket is met, that's all someone is going to pay. So let's talk about statistics. And these are the numbers. The statistics are what should motivate you to really start talking to more people about our healthcare plans, because 70% of Americans have the wrong health plan for their needs. They're either on a high deductible plan or they don't have a plan that covers their catastrophic needs. They're on a low cost doctor visit only plan, or maybe they only have telemedicine. And we have all of this baked into our plans for one low monthly plan cost, right? But we can help 70% of Americans that are on the wrong plan. We can get them through our process, help them get a quote, and then get them booked for a call with our benefits team. And our benefits team will tell them, hey, you're already on a great plan. You need to stay where you are. Or they'll go through and poke holes in their current coverage, if they have coverage at all, and show them how our plan might be a better solution for them. The next statistic I want you to understand is that 65% of personal bankruptcies are caused by medical debt. And here's the staggering number on this, okay? Out of that 65% of people filing bankruptcy because of medical debt, 9 out of 10 of those people had insurance. Now that goes back to the 70% of people have the wrong insurance plan, right? So when you're talking about healthcare and you're asking that basic question of what are you guys doing for healthcare, and you're bringing them or bringing our plans to their attention to show that we might have a better solution for them, you're really, really doing someone a favor by possibly approaching one of those 70%ers that's on the wrong plan and helping get them into the right plan, especially if they're self-employed and they're out there having to search on their own for health insurance, because there's not a lot of guidance in most cases. So I want you to understand those numbers. Now, where did I pull these statistics? This is the flyer that is available for all of you in the Agent Resource Center. So to access that, if you're new and don't know where that is, you want to log into your back office through the footer of davidallencapital.com using your agent ID number and password. And then once you get logged into your back office, on the left-hand side of the dashboard, you'll see a link to the Agent Resource Center. When you click on that, it opens up on the Getting Started page, which is your basic training, but across the top of the page, you'll see all of the different services that we offer. We have our healthcare division tab in the Agent Resource Center. When you click on that, it opens up Health Share and RX. Click on Health Share and you'll see this flyer down at the bottom of the page. It's customizable. I have mine pulled up in Canva where you can go in and you can add a QR code to it. You can add your name and have it as a printable flyer. This should also be available to order over on our VistaPrint Pro Shop store. Okay. But that's where I'm pulling these statistics. And if you'll just study these numbers and get familiar with some of the basics, like, you may have heard me talk about my story and me sharing my success stories in the past. Or again, if you're new, you haven't heard those, right? But I ask people, what are you guys doing for healthcare? And it gets the conversation started. When they get that conversation started, they're either telling me that they're on an employer plan, or maybe they are the employer and they're coming up for their annual renewal and they're complaining about how expensive their coverage is, or they have coverage, but it's a really crappy plan, or maybe they have coverage, but it is what they say in the industry as a skinny network, meaning that they're on an HMO, a healthcare management organization, where you have to see a specific set of doctors as your primary care doctors, and you can't see someone else outside of that network, or you're not included in your network coverage, and then your costs go up. So there are a lot of different plans out there that don't even compare to what we offer, because ours is very robust. Even though it's not an insurance plan, it looks, feels, and works exactly like an insurance plan. And the best part is it works in all 50 states, right? No matter where someone lives or where they're traveling, they have the same network coverage in all 50 states. And our plan, which we don't talk about often, is it'll cover you even if you're traveling internationally. So, someone that is traveling outside the United States for work on a regular basis or vacationing, if they have an incident happen while they're in another country, they're still going to be protected with our coverage. But get to know those statistics. So, as I said, when I asked the question about what are you guys doing for healthcare, and that conversation comes back, I always kind of open that door and say, well, hey, I don't know if you're open to it or not, but I'd love to get you a quote. We're typically seeing about an $8,000 a year savings for individuals. That's this first number right here, right? $8,000. If I'm talking to an employer, I'm saying, well, I don't know if you're open to a quote or not, but we're typically seeing about a $4,000 a year per employee savings on our plan. So if you'll just ingrain these in your mind and your memory banks, I think these numbers on this statistic sheet will help you. And you certainly don't want to be spilling all of these numbers out to someone. You want to be able to appropriately quote that statistic in conversation and make it a conversational topic there. Okay. All right. So I'm going to come off a screen share and let me see. Let me make sure I didn't have something else open over here. Oh, I do have something else open that I wanted to show you, and that is back over on our DAC Healthcare co-branded page. Guys, when you get someone through your DAChealthcare.com, let me pause that for a second. Go open that page. Let me show you something. And I can't talk about this enough to make sure you understand the importance of this, okay? Okay, back to screen share. Okay, so you've got someone that's interested in getting a quote. You get them over to your DAChealthcare.com/YourID webpage, right? And you have several different buttons here. You have schedule a call, you have a learn more button, and at the bottom of the page, you have get a quote. This is where I always take people through. I don't just send someone my link. You can, but I like walking them through the process. I get them on the phone. I start asking questions. I click get a quote. When I click on get a quote, it automatically takes me over to a form. And I want you to pay real close attention to what I'm about to say, because this is a misconception in the field, in our agent field, right? And I know it is a huge misconception with our prospective clients. And that is, when it goes over to this form and you fill this form out, all that is doing is taking you over to this page. And if you do the get a quote, it's going to take you to the get a quote link, or if you do book a call, it's going to take you directly to the book a meeting. But by filling out that form on the DAC Healthcare page, now they are a lead in your system, and you got an email saying, congratulations, someone has visited your HealthShare page. I forget how it's worded, but you get an email letting you know that somebody filled out the form on your DAC page. Here's the kicker. If you do not follow up with that client, or if you didn't walk them through the process to know that they went in and actually got a quote, or they have booked a meeting, the misconception out there is people think that once they fill out the form on dachealthcare.com, that somebody's going to call them. And that's not going to happen. There's no action coming from the Clearwater team unless your client does one of two things. Okay. Number one, they go through and they book that meeting. Okay. That's when the Clearwater team is really going to be connected with your client to have a conversation. But that book a meeting is not a phone call. That book a meeting is a Zoom link. So your client is going to need to go to their email and open up the email to the Zoom link to be able to join the meeting that they have booked at the time and choice, time and date that they choose. On the get a quote, when they fill that out and go through and submit their name, email, and phone number, now they're in the Clearwater system. But until one of those two things happen, there is no connection between DAC and Clearwater other than they just filled out a lead form on your DAC Healthcare page. Okay. So please share this with your team if you have teammates, and if you have a client that is interested in getting a quote and interested in our healthcare, if you're sending them your link, which you can, if you see that email come in saying that they filled out the form, you need to pick up the phone, call them and say, hey, I see that you started the quote process on our site. I just wanted to see how far you got. Did you go over? Did you actually get a quote? Did you book a meeting? Find out what their next steps were so that you know that they're now connected with the Clearwater team, so that there's further conversation. Otherwise, they're going to be sitting there with no one reaching out to them because they just filled out that first page, and you're going to think that your client's moving through the process. So you have to understand how that works. Okay. So that's what I wanted to show you. And we'll go off screen share. And now I'll open up. We've got a few minutes here. If anyone has any questions or success stories that you'd like to share, I'd love to hear those. If we don't have questions, then we can wrap up early. It's all up to you. This is your training each week. Oh, one other thing I want to share is who should you be talking to? I have a hairdresser that has come on as an agent, and she is so excited. Last week, I gave you a tip of looking for Medicare agents as far as referral partners with this. Medicare agents are great because they have clients that are already in their ecosystem that can use our RX plan, or they have family members that might benefit from our healthcare plan. But another one is hairdressers. Think about this. If you bring on a hairdresser as an agent for healthcare and RX, they have a captive audience for 30 minutes at a time as they have clients sitting in their seat. So it's a great time for them to have a flyer posted in the seat. And as that client is sitting and looking around, they might bring up the conversation, or the hairdresser might say, hey, I just got started doing this part-time and wanted to bring this to your attention. I now have the ability to offer healthcare and flat fee RX programs, and bring it up so that that hairdresser can kind of gauge to determine if the client is interested or not. But just want to give you some pointers there on who you can talk to and who you can be working towards recruiting. For those of you that may or may not be aware, David announced on Friday that we have a recruiting incentive right now through the 15th. So now's a great time, even if you're just talking to them about healthcare, even someone that's focused on healthcare. I shouldn't say just, if that's what you're focused on is healthcare and the RX plan, still, I would be going after this recruiting incentive, because someone that you recruit that wants to do healthcare may run across a business owner that's looking for funding too. And we've got that as a solution. That incentive gives you the ability to earn a 25% enroller match, whether you're engaged or not, whether you're qualified or not, you're going to earn a 25% enroller match on them as long as they get a funding within their first 30 days if they started between the 5th and the 15th. And that new agent, if they get a funding within their first 30 days, they're going to get paid as amped up. So it's a great time for someone to be getting started with DAC, a huge incentive for them financially to find funding clients, and a huge incentive for you as their enroller if that new agent goes out and finds a funding client. Okay. All right. So that's all I have. Any hands up before we wrap up here? No, we've got a quiet group today. Do you see anything in the chat there, Sharon or Morgan, that needs to be addressed?
I don't have anything.
Wow, I must have just given you all the information that you needed with no questions today. I love it. Hey guys, appreciate you all for being here. Make sure that your team sees this and is staying plugged into what we have going on. DAC is a great place to be, and we're going to be changing the direct selling space with what we